Hello and welcome. I'm Art Blank, President and CEO of MDI Hospital. This is the fourth in a series of virtual town halls we are hosting to keep our community informed about COVID-19. As of today, the Maine CDC is reporting 6,054 cases of COVID-19 in our state and 67 in Hancock County. And Johns Hopkins is reporting 8.8 million cases in the United States and 43.5 million cases worldwide. So as this global health crisis continues, MDI Hospital and our community are very fortunate to have such highly educated, skilled, and dedicated caregivers. Today, you'll hear from two of those practitioners who are at the forefront of our coronavirus prevention efforts at MDI Hospital, Kate Worcester and Dr. J.R. Krevans. Kate Worcester is a certified physician assistant who has been our primary testing tent practitioner and has taken a lead role in counseling and providing contact tracing assistance to residents and visitors. Dr. J.R. Krevans Jr. is chair of the Infection Control Committee at MDI Hospital and has been a guiding force for our COVID-19 preparedness response. He has an extensive background in public health, emergency preparedness, and management of infectious disease. As we work to address the COVID-19 pandemic in our community, we are focused on providing as much information, education, and support to the public as possible. MDI Hospital follows all Maine CDC guidelines for distancing, masking, and screening in order to provide a safe environment for patients to receive care and needed services. We take the health of our community very seriously and will take every appropriate action to continue to provide our region with safe, responsible care in accordance with CDC guidelines and our health and safety policies and procedures. Today, we will discuss local coronavirus updates, safe traveling, and hosting practices during the upcoming holiday season. And we'll answer your questions, some of which were submitted in advance, and some will be answered today. So if you'd like to ask a specific question during the discussion, please use the Q&A feature located in the bottom panel of your Zoom screen. We'll answer as many questions as possible, time permitting. Those that we do not have time to address will be followed up by email after the event. So again, thank you for joining us. And we do have one question that has been submitted ahead of time that I'd like to ask our moderator to share. I know it's top of mind for some people.
Thank you, Art. In response to a recent Facebook post, what are you going to do to reassure the community that your hospital is a safe place to help for a problem and not be a place that we go and worry about being exposed to the virus that most of us are working to avoid?
Well, as I mentioned earlier, all employees are asked to adhere to the prevention guidance by the CDC and the State of Maine Public Health Emergency to mask when physically distancing cannot be maintained, physical distance, and proper hygiene. And we expect our employees to adhere to these guidelines both while they're at work and also while they're not at work. And while we can't discuss individual personnel matters, we can assure you that any employee known to have acted in a manner that does not follow proper health and safety precautions in accordance with our policies and the guidance of the Maine Center for Disease Control and Prevention will be required at a minimum to quarantine for 14 days, receive mandatory education and training, and be subject possibly to disciplinary action. So I can, again, assure you that we take your health and your safety very seriously. And to answer the second half of the question about our environment, I think that best be answered by Dr. Krevans. JR?
Hi, so JR Krevans here. You may see a different background than you have on some of the previous teleconferences. So when we talk about travel, I can explain about where I am and what precautions we've been taking. But to talk about the hospital and the staff right now, we from the beginning have followed very strict guidelines. We've tried to anticipate. I guess one way to look at it is sometimes the federal guidelines lead the state, sometimes the state guidelines lead the federal. We track both, and whichever one is more protective, we work to follow. There's a group of us with specialties ranging from environmental services, physical plant services, nursing, medicine, who meet on a regular basis. And talk about everything from what cleaning agent should we use to which rooms need more fans. We've installed a whole bunch of new ventilation systems. And very particularly, how to make sure that everybody's as healthy as possible. We have aggressive screening before people enter the building. Each time you enter any of our buildings, you're screened for health, as well as also for questions related to, we do temperature checks, so that's probably less effective, but it's required. And we follow universal masking within the facility. Whenever we are near patients, we use medical grade masks, and we expect the patients to wear masks unless their face is being examined. And when we're working in the same room with someone else, we wear masks to protect each other and to protect ourselves from each other. The medical and nursing staff and the other staff of the hospital are very serious about this and are quite committed to this, and it's huge thrust. Right? We don't want to make our patients sick. We don't want to get sick.
Thank you. So let me ask you. You're clearly in a different environment, as you said, than normally, and you might want to talk about what is the safest means of travel during this pandemic.
Actually, I would say I'm in my normal environment. I'm up in the mountains right now. I happen to be in Montana, and it's where I spend a lot of my time when I'm not at the hospital. This trip was delayed from March until now. When I travel, I basically do the same things I would do at home. The precautions are the same. Don't be within 6 feet of somebody without a mask on, right, with both of you having masks on, unless you want to exchange germs with them. I am generally careful about surfaces, wash my hands, but airborne and droplet is where I worry the most. I am very careful of both the large and small environment I'm in. So for example, in Maine, I don't hesitate to go to a grocery store because it's a reasonably low risk environment. The stores are careful about their ventilation. Everybody wears a mask, and the chance that any individual person is infected is low because Maine has been careful. I guess I should put a note in right now that as I travel through a bunch of other tourist areas and see their practices, I just want to commend the Mount Desert Island hospitality community for doing an incredible job this summer. In a lot of places in this country, I wouldn't go into a store. I mean, I'm going into a store full of people I don't know. I assume that if they're not wearing masks around me, they weren't wearing masks around the last person who was contagious either. And so I think very carefully about where I do my shopping. I'm using military commissaries because I have that option. I think very carefully about going to restaurants, which means I don't. That's clearly a high-risk activity. And I spend my time out of doors, visiting family, And that's one of the other main purposes of this trip is visiting several sisters and our children scattered across the country, is we're meeting outside. We're eating outside. We're walking together in parks. But since they're in their own bubbles where they work and they study and they have their own risks, we don't see any need to carry germs from one place to another. As far as safety of the different means of travel, if you have the time, traveling in a vehicle, of course, that exposes you to the usual road hazard risks. Traveling by vehicle does have its dangers. The big question that comes up a lot is traveling by air, when there's been basically two groups of studies in the last couple days, which came one about a week ago, and then one came out yesterday, which were somewhat contradictory until you get into the details. There have been a series of epidemiologic studies of flights from the Middle East to China on airlines where basically you either wear a mask or they push you out the door. Possibly while they're on the ground, possibly not. And there has been almost no contagion on those flights. The US military funded and helped conduct a series of studies that use both computer modeling and actual mannequins that produce clouds of vapor and then inhale them to show that on a plane where all the systems are functioning properly, the risk of droplet transmission and airborne transmission is very low if all the mannequins are wearing masks. Just a study yesterday out of Ireland showing a series of contagion events on flights that average 3 to 5 hours in length. And some of the people who were infected were wearing masks, some were not. But the mere fact that that is true tells you that there were people on the planes who were not wearing masks. One of the things that's happening right now on aircraft is there's this rule that says if you're eating or drinking, you don't have to wear a mask. And we all know, there's some great videos out there of watching somebody eat a small bag of peanuts over 25 minutes, one peanut at a time, so they don't have to put their mask on. And that's, you will have limited control over that as a passenger. So those are the choices you have to make. Certainly, if I was flying, I would make sure that I had had enough liquids before the flight and that I had emptied my bladder before the flight. And I would be wearing a mask the entire time I was on the plane. I would not take my mask off to eat or drink at any point while I was on an aircraft. And if there was someone near me not wearing a mask 100% of the time, I would be on my stewardess belt.
Okay. Thank you. So as we enter the holiday season here, there's a lot of discussion about what the best way to enjoy our family and friends. So Kate, could you talk a little bit about, is it safe to attend an indoor family gathering this season?
Chair and I, Dr. Krevans and I, talk often about this subject and has from the very beginning. What we have to consider when we're gathering to eat at a meal is when you're eating, clearly it's one of the highest times risk-wise you're going to have for exposure because you're not wearing a mask, you're eating. So you're also touching plates, you're touching silverware, you're exchanging glassware, you're exchanging food, you're grabbing things, it's a lot of transfer. So what you should consider when you're gathering at a table with those is, what is your family? Who is that circle? If somebody became sick at that table, are you close enough to them? Do you know them well enough that you would be able to know their health so that they can contact you a week later if they become sick? And that's what would be considered your circle, your family, your gathering. So as we go into Thanksgiving and Christmas and all of the festivities that surround the holidays, I think we all need to think about when we go to parties, gatherings, do I know everybody well enough in this setting that I choose to go into this setting where I'm clearly not going to be masked if I'm indoors or outdoors? Outdoors clearly would be far preferred over indoors when you are planning your holiday meals, because ventilatory, air movement, distancing, it's all far easier. If you're going into an indoor setting, you have to think of everybody in that room. Do I know them so well that I could contact them if I became ill, and they would contact me if they became ill? So that it's that type of friendship, relationship, family member. Because we all can think of, I may know those people well enough, but do they know me well enough that I choose to go to this gathering? I do think when we think about designing our holiday gatherings, though, the more we can be creative. I know JR's family's been very creative with their travel, but creating environments where we can eat outdoors, especially if we have family members coming from out of state to gather for the meal time and the holidays, and doing things where we can be more distanced. Those family members that are at higher risk are kept more isolated from family members while still gathering. That would reduce risk dramatically, because we clearly want to see our loved ones for the holiday. We want to gather, we want to, spread joy to the ones we love the most, but we have to consider all of these factors in these gatherings. And we have the ability to really reduce risk. We don't have the ability to completely prevent, but we do have a level of ability to reduce risk. And those would just be suggestions I would do, and I would suggest others for the holidays.
Yeah, so Kate, one other holiday that doesn't typically get celebrated around a dinner table is the one coming up soon, Halloween, and it's clear from our pictures that JR and I do not have young children to entertain. But so from your perspective, Halloween's coming right up. Are there some guidelines that the community should be paying attention to, and how would you guide folks and your family?
I know there's been guidelines put out. I personally do not feel that trick-or-treating is safe, because if we go right back to the same conversation we just had, how do you consider your circle or your family when one of the activities is to go house to house and receive items from house to house and congregate in groups? So I personally would choose to not have my child trick or treat. I may choose to do an abbreviated version through a Zoom. I may choose, because I'm already planning to gather for the Thanksgiving holiday with my grandmother and my parents and my brother, that we do some sort of, my parents dropped off something for my son a week ago for a trick or treat for their Halloween thing. They're part of my bubble. But trick-or-treating to me is a very risky social gathering, difficult to do social distancing. It does encourage mask wearing, but it's, I just feel it's right now with where we're at a very high risk activity.
So Kate and I have a slightly different perspective on this. As she says, we talk not quite daily, probably no more than 4 or 5 times a week. And I would consider it trick-or-treating, if done in a highly organized fashion, to be a mildly increased risk activity. Less, for example, than going to school, less than being on a sports team. And to a lot of people, it's important. So I'm part of a community group that said, how can we do this most safely? Interestingly, there must be people who think like me at CDC, because even though there's a lot of things we have not gotten adequate federal CDC guidance for, in my opinion, on a timely fashion, we got great Halloween guidance that was labeled Halloween guidance. It was wonderful. And the town of Bar Harbor has a plan which has been approved by the state of Maine. You're like, yeah, that makes sense. Where we try to set up an area where trick-or-treating can be done reasonably safely. Is it perfectly safe? No. Is it perhaps for people to whom Halloween is important, acceptably safe? Yes, because it's going to be outdoors. We're working towards directional traffic flow. We're going to have it, because it's in a known location at a known time, heavily patrolled with volunteers and city officials to keep people moving in the same direction and somewhat spaced out, and to create physical space between the people giving the candy and getting the candy with fairly brief interactions. I will say one very specific thing, and this is the level of specific guidance out there. A face covering or medical mask for the prevention of transmission of germs is different than a Halloween mask. And interestingly, and yes, this has been tested, in general, they don't play well together. So your costume probably cannot include a traditional full face Halloween mask, because you definitely need to have a medical mask or a cloth face covering of an appropriate type to prevent transmission. And a full face Halloween mask over that either tends to disrupt the function of your protective mask, or it sometimes tends to make it seal too well and cause problems that the mask isn't designed for. So the costume has to not include a covering over the mouth and nose other than a medical grade mask or a cloth face covering. And the small groups that go together should be groups of kids who normally would be together, not a different social group. And they should, if you want to look at someone's costume, look from 6 feet away. And we're going to try and provide enough people to generally encourage this. Have a party, illustrate that you can have a party and follow the rules. You don't have to crowd everybody together without masks on to have fun.
Okay. So as you can see, there is no cut and dried answers really to any of these questions, and it is a matter of risk mitigation. And that's what we are very blessed to have experts who can share all the different perspectives that we have. So speaking of various perspectives that we've heard, Jared, could you just give us kind of the snippet version of where we are with vaccines today?
Let's see. Today, most recent that I heard was yesterday, maybe even a day and a half ago. AZ has said that their vaccine is showing efficacy in older and younger as far as production of antibodies. Once again, this is not proof of efficacy against disease. So the studies are moving along. The actual efficacy against disease for all of the major vaccines is expected mid-November to end of December is everybody's best estimate. It has been made very clear by the people at FDA that there will not be any quick and dirty approvals. The approval will follow absolute standard vaccine process. So the process is being sped up in terms of manufacturing ahead of approval, manufacturing on risk. And in terms of once the data is available, that's the first thing that will be done is it will be analyzed. It won't wait its turn behind other drugs. But it's going to be going strictly by the standard rules, which is very reassuring to me. The general pronouncements by people who know, and I follow as many of them as I can, suggest that we will have a limited number of doses of a likely efficacious vaccine with reasonable testing by perhaps December, more likely January, with the first group going to highest risk medical people. There will probably be large amounts of vaccine into the high risk community, meaning the elderly and the medically infirm, within a month or two thereafter. But probably not enough doses for the general community until sometime late spring or even late summer. Partly it depends upon there are multiple different vaccines. It's highly likely that at least one will work. If they all work, then therefore all of these manufacturing methods will be available. So I'm optimistic. That's one of the reasons why I'm very, very aggressive about reducing risk now, and think Maine's strategy of saying let's not get people sick now is so good, because I think there's a real likelihood that within 6 months or so we will have a really different situation.
Great. And once you, if you're tested positive, does that, once you've recovered, are you, is there evidence that you're immune from COVID-19 at that point?
Oh, immune, a wonderful word. So immune, absolutely immune? No. You have, so a person who's been infected with COVID-19 and recovered may in fact, of course, continue to have symptoms. That's a big issue for a lot of people. But those people are generally not contagious to others, which is great for the others, not so much for them. Right now, the data says that you're probably protected for at least 90 days, and the CDC is actually not recommending retesting people, except under very special circumstances, if they have had a positive test within the previous 90 days. Clearly, by 6 months, there's significant waning, but the number of recurrent cases is low. I would look at it as saying that you're protected, that you're resistant, but not absolutely immune. And I think that way of thinking about it should be carried over to the vaccine. Some vaccines, like measles vaccine, makes you immune. Other vaccines, like flu vaccine, make you resistant. It decreases the chance you'll get it, but it doesn't eliminate it. So I would say it's fair to say people are resistant for a period of months after a known positive. But how long that's going to last, we don't know. For other coronaviruses, it typically lasts 6 months to 2 years. It's not permanent.
It's important to comment here. If you test positive for COVID-19, when you're contacted by the state, which you will be contacted by in a very efficient manner, as well as somebody from our hospital, you are released from your quarantine after 10 days. And that's pretty standard now. So when we're thinking about, clearly we're talking about, is there a level of resistance, which JR is giving great data there that there is. Is there, evidence to say we should retest you if you become symptomatic again, within that 90-day window? But that's always important to go back to, because we clearly have people in our county and in our area who are COVID positive, and they are released from quarantine after 10 days and not having symptoms. I mean, they clearly also have to be symptom free before they can return to social distancing or a work setting. Just want to add that part.
So, Kate, I know you've been dealing with various folks in our community who have a variety of questions. One of the ones that we've heard regards, again, going back to holiday celebrations. So if someone has a family from out of state that is staying with them, should they be required to quarantine for 14 days prior to arriving at the home? Should they be tested before traveling? What's the guidance today?
Everybody should be tested when you travel, whether you have symptoms, you don't have symptoms. I think we're going to share the locations where you can have asymptomatic testing in the state of Maine. I would encourage you to call these centers and be tested. Set your testing up upon arrival. Set your testing up again before you leave, so that you're being tested multiple times. Asymptomatic testing is absolutely one of the very best measures we have of assessing our level of positivity. Having a family member come from out of state, I would go back to what JR was commenting. How did they get here? Who were they with while they were traveling there? What are their underlying comorbidities? What are their risk factors, so that if they do get this would be very critical to them. Again, it comes down to how you get there. Having someone quarantined separate from you 14 days prior to a holiday makes for quite a long holiday break. So again, I think it comes down to having family conversations about, do we feel meeting together as a family, is this essential, and how do we get aunts, uncles, brothers, sisters, grandparents to us that we feel are essential for the holiday in the safest fashion possible? And then when they get here, how do we separate enough so that we're reducing risk? We go back to gathering outside, not sharing same bathroom, really vigilant symptom monitoring, really vigilant hand hygiene in the home. I mean, clearly there's some people that can get excessive with this, but really, I mean, being able to separate out those that travel to come from the people that are already in the home or the family setting would be essential. And then gathering in an outdoor setting when you're going to have your social gathering period of time would be my recommendations. Currently in the MDI area, if you're planning to travel, the very best place to be tested for asymptomatic testing is Convenient MD. And so if anyone is planning on traveling, calling there to set yourself up with an appointment is done. You can do it online. They have a portal. You get everything, all your registration information and appointment. You have your test done in a timely manner, and you check your results yourself online. You're only contacted if you're positive. And they have a real nice window with what the turnaround time is. So if anyone is planning on traveling, I highly encourage you to go onto any of the Convenient MD. The website will show you the closest location. Brewer is our closest one here that does the asymptomatic testing. They do it in a timely, efficient, organized way so that you can still have your travel plans in place.
So as you're figuring out what the safest configuration is for this family gathering, should some people actually be wearing masks at these gatherings and social distancing?
You know, again, it comes down to mask wearing does reduce risk, and those family members that would be higher risk wearing a mask at a family gathering would be recommended, especially if it's indoors. It always comes down to the eating and sharing joy part of family gathering, and that would be best done inside. Clearly, this is not possible for every family. I mean, my own 95-year-old grandmother wanted to go to a gathering of her and her 13, like I have one of 13 on the other side with grandmothers, together because they're 95, you know, to have a gathering. And am I supportive of this? Clearly, no, but it's all of her sisters and brothers that want to gather. And so I said, could it be outside? Wear a mask, you know, all the time. This, you know, and you have to give as best of advice as possible, but you have to understand too, like my grandmother said to me, I'm 95 years old and this could be the last time I see these family members. This is important to me. There's a, like, you know, I think later on we're going to talk about this, but there's a human piece too with, you know, when you're gathering with this loved one and you want to be close with them, understanding just again, are they in your family bubble? Do you know their health history and that whole piece? It, you know, clearly it's complicated.
And does it help to have windows and doors open?
It does. Windows, doors open. I think Jared was talking earlier, we had a conversation about fans and ventilation, and the more you can move air movement. I noticed a lot of restaurants doing that. I think that's fantastic, and I applaud you for keeping your windows open as long as possible. Being able to sit outside on some of the restaurants that have the outdoor seating on the streets is fantastic. That's all great modifications to keeping businesses open and, you know, keeping those businesses alive, which is important.
Yep.
So this is JR. I've been in contact with a series of families who've been trying to set this up. You know, where you get a circumstance. I mean, when you have a 95-year-old grandma, she's correct. This may not, you know, putting it off till next year may not be the best option. Then you need to think about, can everybody else mitigate the risk? And one fairly straightforward and extraordinarily successful way is to do what the services do when they bring people in, what a lot of colleges and universities have done, which has been very successful, which is everybody who is out in the world, the people who are out there studying, working at restaurants, whatever they do, really aggressively quarantine, minimum outside contact, what little outside contact they need to have, being extremely careful about wearing a mask, as though they themselves were the 95-year-old person for a week, and then get tested. Don't get tested at the beginning of the week. If you make yourself at extremely low risk for a week and then get tested, the chance that you will be carrying and not pick it up on the test is very, very low. Even if you were infected, it's under 10%. And so if everybody who's coming to visit does that, but it means they have to structure their lives in advance as a way to then make everybody at the gathering safe. And are you willing to do that in order to make it as safe as possible? Because then you can really say, we now have a family bubble where we're all starting out very, very likely to be uninfected. And so therefore the rules are different.
Thank you.
You have to be serious about doing that.
Yep. Okay, well, thank you. I think we've got some questions from the audience, and so why don't I ask Danielle if you have some questions for our panelists?
Yes, absolutely. So does the use of air purifiers during an indoor dinner with a guest or two reduce the risk of contracting COVID when each person is distanced at all times and masked except for while eating and drinking?
Yes, if the air purifier has a high efficiency filter.
I agree.
Great, thank you. Another one is, are the masks you use vented so that they protect the wearer but not others?
The masks, we do not use vented masks at the hospital. They are actually not allowed in medical circumstances. In fact, you shouldn't be using a vented mask during the coronavirus outbreak except under extraordinary circumstances, a medical care worker who cannot get another type of mask. Vented masks are for people who are being protected from noxious, like cutting concrete.
We're wearing surgical masks when we're in the office setting, and we offer a surgical mask to patients when they come through the door. So if you only have a cloth covering mask, we actually offer you the next level up of mask. When I'm in contact with symptomatic patients, I'm wearing an N95 mask plus a surgical face mask plus eye covering, and very soon to be full head covering plus a gown. So, there's different levels of protection according to risk of exposure, how close I'm going to be to that person for a period of time.
Yeah, interestingly, State EMS briefly was using vented ones because that's what they could get. And they're very comfortable, but then as with they realized that this was not ideal, and so they've now moved away from those, or they literally, if they're using a vented mask, they cover the vent with another lightweight cloth or paper mask to protect others from themselves.
All right, thank you. Kate, could you walk us through what is considered primary exposure, please?
Sure. Is that a question from the outside, or you want to talk through getting a positive business?
Yeah, we can. Yes, let's do the business.
Okay. Because that can cover all of it. So let's talk about the hypothetical positive, COVID case in a business setting. So when this happens, it happens on a couple levels. It happens on the CDC level, where they contact the COVID positive patient to state that they're COVID positive, and then they're going to do contact tracing. And the contact tracing is going to say 2 days prior to you ever having symptoms, where were you? What were you doing? Who were you in contact with? So then it leads us back to can I actually say what I was doing 2 days ago and name every single person that I was in contact with? But that's going to be the questions. And then you're going to come down to, who have you had close contact with 2 days before and up until this moment where you're finding out you're COVID positive? And that's going to be anybody that you spent greater than 15 minutes, less than 6 feet, masked or unmasked. Clearly unmasked, drastically increasing your risk. Masking, significantly reducing your risk by being masked. I pressed that to the CDC epidemiologist because clearly masking is, but if that, the longer the time with the masks, clearly with social distancing, that's considered positive contact. If you've had contact with someone who's confirmed COVID positive, we test you at MDI. And I call that baseline testing. because most everyone does not have symptoms at this point. So we do a baseline test, and then you are quarantined for 14 days where you are not able to come and go from the home. The family unit, in the ideal circumstances, all needs to stay together, and no one really should be coming or going from that family. I always say these are ideal circumstances. Again, not everything's ideal. And you are symptom monitoring. So you are symptom monitoring for those symptoms so that if you get symptoms, we retest you. The caveat there, and I think Jared would probably add this, is the ideal circumstance if you're in direct exposure with someone who's COVID positive is to actually isolate yourself from your family members. But a lot of people can't do that. A secondary contact is somebody who was in contact with somebody who was COVID positive. That's what I call secondary. And I guess tertiary, it goes all down the line. If you fall into the second, third, fourth, fifth, any of those, you fall into the I think category, which is something we'll show later. And that's where you are symptom monitoring only, and no quarantine is required. But I encourage people to really vigilantly monitor for symptoms. Have mask wearing at all times, hand washing, social distancing, et cetera, et cetera. I'm reading the screen as it comes up. Each COVID positive patient gets a case name. An epidemiologist gets assigned to the case number name, and they do the contact tracing that is turned over from the hospital. We do the question answering and the phone call answering to basically correctly give people public health education in regards to their risk stratification and whether they should be tested or not. This has clearly happened in businesses. It's happening, and it will happen, and it's going to be a repetitive Groundhog Day activity that different businesses have to do. I encourage you to reach out to us. We've done this now multiple times. We know what to do. We do our baseline testing. Everybody quarantines that was in contact, and then they symptom monitor for the 14 days, and then they are released. The 14 days is the quarantine time. If you're COVID positive, they actually do release you, the CDC, after 10 days. So there is a difference in the CDC guidelines there. But that walks you through what happens. Your business, if all of your employees are all working one shift together, is shut down for 2 weeks. That's happened. Those businesses where you have employees that would have had exposure that are then going to be quarantined, but you have those employees that didn't have any exposure, they recommend 48 hours of no one inside the building. They call it a COVID cleaning, which is a very extensive deep cleaning. And then businesses have reopened with employees that come in that were not exposed in the work setting. So I have seen that played out as well. Jared, do you have anything to add to that?
Yeah, one of the things that's different than earlier in the year, as far as one of the reasons why businesses are a little more at risk in terms of large numbers of employees being considered close contacts, is there was a recent change in the definition of 15 minutes, which sounds like a very strange thing to say. Originally, they talked about, based on good data, 15 continuous minutes was typically required for infection. Not always. There are certainly some very brief contacts that did it, but that was less common. But as we've learned more about both the biology, a series of virus particles inhaled an hour or two apart are just as effective as the same number of virus particles inhaled all at once, and also some real outbreaks. They've defined 15 minutes now as 15 minutes over the course of a day. So, for example, and this actually was where a series of the studies were done, was in jail guards who had no more than 1 or 2 minutes at a time of contact with a series of prisoners. And they knew that because it's all videoed, right? But over the course of the day, if they spent 15 minutes near each other, either the guards could give it to the prisoner or vice versa. Great study setting. So because of that, if you have a store and the employees are usually 4 or 5 or 10 feet apart, but they constantly are passing each other or chatting, or my cash register paper is jammed, can you help me? That adds up over the course of a day. So if you are a business trying to maintain continuity, you really want to think about saying, all my employees who work morning shift, and my afternoon people work afternoon shift. And so I'm not going to lose everybody all at once.
I'd like to add to
The same is also true of schools.
Yeah.
The schools are facing the same circumstance where they have to think about, if they don't cohort the kids, they run the risk of more kids being out all at once.
To give for an example, there was a particular business.
Hey, your volume's up a low.
Sorry, can you hear me better?
Yes.
One of the, there was a early on case with a positive patient who was on a boat, and they were outside, air everywhere, and they had each person on the boat 6 feet apart, and everyone wore masks, and they were outside sightseeing. And per the CDC, that was not considered anybody being a contact because they're outside. So when you're thinking of your family gatherings and being out at sea on this boat, and like they didn't have us do any contacts on that boat because of the spacing, the mask wearing, and the ventilation. So there's just a thought when you're structuring your business, and they were on that boat for a period of time, but they did stay far apart, and that was not considered where.
And I'll say one other thing about businesses, especially in this world of modern social media where everybody learns everything. If you hear that a business had a positive case and they reopened 3 or 4 days later, you might be tempted to say, well, I'm not going to go to Joe's store because they had a case. Of all the stores in town, they are probably the most likely to be safe. Because
I've had a phone call from every single person that works there. So
right.
And we've thought through everything. Yes.
Right. So yeah, so please do not avoid businesses. The business, because when you do that, it encourages businesses to hide it. And there are some states where they've essentially said, we're not going to release this data. We don't talk about which schools have problems, et cetera, because they don't want this to happen. So then therefore things get hidden. Here we find out about them, but that if, you don't have to worry that the Maine CDC is not being careful. They've been accused of many things, but carelessness is not one of them.
Danielle, thank you.
Yes. One that just came in is my daughter, an ER nurse in Massachusetts, tested positive in June and remains positive with plasma donation. Her husband and children have tested negative. They have had no symptoms since then. They would like to come for Christmas, and should they be tested before coming?
Want me to take that, Kate?
Yeah, you can answer.
Sure. So I would say they should be tested because they're coming from Massachusetts. Because Massachusetts, while technically does not require testing, I will tell you their rates are now significantly higher than ours. And they're coming into your bubble. The fact that she tested positive back months ago makes her lower risk. The part of the question that I have to sort of guess on, if she's testing positive on plasma donation, that implies that she's antibody positive, because that's what they check for, the plasma donation. Because that's thought to perhaps provide a useful plasma for treating people. So that would make me worry a little bit less if in fact it's an antibody test. But I don't know enough to say that for sure, but I would just recommend testing. I would not automatically consider, because by Christmas it's going to be more than 3 months, so I would not consider her automatically immune and not appropriate to test.
Great, thank you. Kate, do you want to kind of go through a little bit about organized sports right now and whether or not they're safe and precautions parents can take?
I can comment again from a personal standpoint, and then say what suggestions I have to reduce risk. I think kids need to do activities, and I think they need to stay physically fit and active. And I personally have had my son participate in a modified form of sports, being one particular sport. And I will say that every person that we participate with in this, I don't know how that just changed on my view here. Wait just a second. But when we do it, it's they basically do it with contacts, so that it's only a certain amount of kids in one gym with only so many spectators that are 6 feet apart, where everybody's registered into this one gym, and you participate against the same kids, so that week to week that you're able to do those contacts. Are they reducing risk? Yes. Did we do it outside this summer? Yes. Are they doing it in private places that are big and ventilated well? Yes. Moving forward, we're going to have to start to think about sports more. Moving sports outside is ideal. Sports that are inside are going to be more difficult. But reducing your number of people in a building, knowing who everybody is there, so that if somebody is positive, you're able to contact everybody, is essential. I know it's a very sticky subject, but I will say that I think one of the things that really is a concern for me is the lack of socialization. Some kids, all they have is sports, because school is such a difficult thing for them. Sports is where they thrive, and there are kids that really need, some kids, it's the only time they get physical activity is during their physical education class. And I just think we need to think more about how to make changes so we can keep kids active and reduce risk at the same time. We're not going to be able to prevent risk. But I know JR and I differ on sports, and so, but I just wanted to put that in. I'll speak on it at least.
Great.
I don't know that we differ that much. I think the big thing for me is I think that sports are really important. I think this is a singular opportunity for us to be pushing kids to be more outside more, and schools to think about that. Why can't we do more sports outside in the winter? I mean, it's not that cold for kids. But the other thing though is there's a portion of sports that is about organized spectatorship. And while I can see risking closing schools in order to have a sports team, and that's what we're talking about, I can't see increasing the risk of closing schools so that a bunch of people can sit in the stands shoulder to shoulder shouting and pretending and not keeping their masks on because that's what we do in the winter. That's not an acceptable risk, because the reality is people say, well, that's not going to infect the kids, but these are all the parents of the kids. If you infect the parents of the kids, you infect the kids. If you infect the kids, you close the schools.
I agree with JR there.
So,
this is a more modified version.
so we're getting close to the end of our time together, and I know, Kate, do you have some general advice for community members as we enter the winter season to protect themselves?
I will say, we've talked a lot about protection, but one piece of general advice, and this came from experience I had with a recent, COVID positive parent calling me who was symptomatic and scared. And they drove down because he was scared. And that's why we're here, is to take care of people and make sure they don't get sicker while they are acutely ill. And he drove down and he had to bring his 2 children with him, because that's who was in his family, and his children were home with him when he got the call. And the 2 kids were sitting in the back seat, and I was talking to these guys about it earlier. It was like very emotional for me, because the biggest concern after we found that he was completely stable and fine and needed some reassurance and needed an inhaler and just really needed to be reevaluated like we've had to do, is for me to talk to the 2 kids in the back seat, because they had their masks on and their tears were running down their face. And it was really emotional, because the kids are worried about going back to school. Like, they're worried about what people are going to say. And so I just would encourage people to be kind, because it could happen to anyone. I hate to get emotional, but I felt so bad. But just to be kind, that nobody can completely prevent this. We're all trying to be careful. We're all trying to take care of each other, but we have kids that are really scared. They've never seen anything like this, and their parent is sick. And we need to all extend that level of kindness rather than that level of fear. Less judgment, more forgiveness, and trying to just all be responsible for ourselves as much as possible, and not casting our opinions on others, because that was important to me, because the kids are having to watch their parents go through this, and they're thinking of, what's it going to be like when I go back to school? Am I always going to be seen as the child that brought it to the school? It is, and the level of keeping your privacy is difficult. And so I just encourage everybody to respect each other's privacy and try to be more supportive as a community together rather than individualized. I didn't mean to get emotional there, but it was really sad. The little girl broke my heart.
I think that's thank you very much for sharing that. I think that it's a great lesson for all of us. And as we start to get into the winter season, and we're all looking to change the routines that many of us have gotten into, where we really relied on being outdoors most of the time to stay safe, it is always important to remember that there are a great deal of places where there is risk, and that the best thing that we can always be doing is just to mitigate that risk, and then work to make sure that that we're supporting each other in this process. So thank you all for joining us this afternoon, and thank you very much to our panelists for sharing their expertise. As I mentioned earlier, MDI Hospital is committed to the safety of our community and to providing information, and support, and education as much as possible to mitigate the spread of COVID-19 in our region. But we cannot do this without you. We need your vigilance, your support for one another, and your awareness of the need for better testing and treatments and vaccines. Although the incidence of COVID-19 in our community remains low, we must continue to be hypervigilant in our precautions. And I need to repeat again the appreciation that all of the caregivers of our organization have for our community. We know how hard this period has been for everyone, and it is really encouraging how hard people have worked and how the community has come together, the business community as well as the nonprofit community and the municipalities, to provide as safe an environment as possible. But until a vaccine is available, wearing a mask or face covering, practicing physical distancing and hand washing, and avoiding crowded situations with poor ventilation continue to be the best things that we can do to protect ourselves and our community. So thank you again for joining us today and for your ongoing commitment to the health of our community. We consider the health and well-being of our patients, community, and staff our #1 priority, and we appreciate your participation in this important event today. So thanks again. Have a great day.